The COVID-19 treatment pill is available for adults. It's not yet for kids under 12, leaving them with few options for treatment.
CBS 17's Judith Rotana getting some answers for us tonight on how UNC Health is changing that.
We're really focused on these kids who aren't as likely to respond to vaccination or aren't as able to fight the infection.
Dr. Zach Willis, an assistant professor of pediatric infectious diseases, says he's not overly worried about healthy children infected with COVID. CDC data shows more than half of kids who end up in the hospital with COVID had at least one underlying medical condition.
Chronic lung disease, who have chronic heart disease, who have obesity, diabetes, all of those conditions can make it harder to fight off COVID.
For those under 12 or under 88 pounds, the only option for treatment is remdesivir. That requires them to go to a facility for IV infusion for 3 days.
Children really need to have the option of being able to take a by-mouth medicine that will reduce the risk of complications of severe COVID.
UNC Children's Hospital is enrolling immunocompromised children in a trial for Paxlovid. The pill proved to be 90% effective in preventing severe illness and death in adults with compromised immune systems.
But we wouldn't have any vaccines, we wouldn't have any drugs for this if people didn't step up and participate.
Participation in the trial needs to start within 3 days of a positive test. Willis knows participating is a big commitment, but it's also the reason we've gotten this far in our fight against COVID-19.
People who have participated in trials of different vaccines and treatments really should be considered heroes.
If you have a child with a compromised immune system and are interested in this trial, I have what you can expect from it, including the time commitment, online in my story at CBS17.com. Judith Rotana, CBS 17 News.